Thanks for coming. My name is Alexis Chapman, and I'm here today to give an informative public speaking about the importance of taking care of your mental health. So, 1 in 5 U.S. American adults are faced with being diagnosed with a mental disorder. So that can include your close family, your friends, co-workers, and etc. The 4 main disorders that we're going to talk about with mental illness today is going to be depression, anxiety, bipolar, and schizophrenia. I also have personal experience in this field with working 13 years as a nurse with a lot of mental health patients. Also, I'm a mother who dealt with mental illness, and I have personal stories as well. So, a lot of with mental illness is mood and behavior, and it looks different on everyone. People can have different thresholds of it. Some people can be really affected by it, or some just have a milder case of it. So the way that you would want to treat mental illness is, first off, find a psychiatrist that you can trust, that you can get diagnosed properly with. Hopefully from there, they can work of getting different medications. The medicine might not work the first time, and you will have to do some adjustments. Very frustrating, but that's the best way to get treated. Also, self-care, and such as if that means taking a luxurious bath, if that means going to your nails or your hair, keeping up grooming. Meditation is another great thing. Exercise is a great thing to keep up your mental health. Eating a healthy, balanced diet, and get enough sleep. Another thing that's good is counseling. And you probably won't be able to find the correct counselor the first time around. So, call in medication. Try again till you find a therapist that can help. And that might mean seeing them once a week to maintain your sanity, or if that means every other week or once a month. That's something for you all to decide, and it's always good to have other people's input, such as your families. So some medication that we're going to talk about today is the SSRIs. The 2 popular, that's what you basically treat most mental illnesses with. The 2 most common ones are Zoloft and Prozac, and that is to increase the serotonin levels in your brain. There's also MDRI, which is Wellbutrin. You can actually take one SSRI and an MDRI because it works on 2 different parts of the brain. And Wellbutrin increases the dopamine and norepinephrine levels. There's also an SNRI, which is Cymbalta and Effexor. They increase both the serotonin and norepinephrine, but they also, besides helping with your mood, they can help with different types of pain that can be brought on by depression or other illnesses. So, mental health, reaching out does not make you weak. It means that you're brave enough to finally get in touch with reality. Medications, the CDC recommends staying connected to others and getting enough sleep, exercising, and managing your stress. The World Health Organization says depression is the leading cause of disability worldwide, and suicide is the top cause of death among of young people. These are heartbreaking numbers, so we need to remind ourselves to be kind to whoever you meet. So we're going to talk about depression. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest and hopelessness. All depressions look different. Doesn't mean that you're sitting in a bed crying all the time, but again, that's for a psychiatrist to diagnose you with. Anxiety is mental illness that causes constant fear, worry, and is characterized by a sudden feeling of irritable, restless, and discontent. Bipolar is a mental illness that is characterized by extreme mood swings, and it can either be extreme mania, which is a high, or extreme depression, which is a low. Schizophrenia is a mental disorder that comes on by delusions, hallucinations, and disorganized thinking with abnormal behavior. So thank you guys for sitting through my talk, and I hope you